Hi, and welcome to video 2. My name is Jessica Drummond. I'm from the Integrative Women's Health Institute. And today we're going to be talking about how to confidently offer safe and effective preconception detoxification programs in your clinic, in your fitness practice, in your health coaching practice, or in your nutrition or physical therapy practice. So, this video is going to talk about the fact that women who are trying to conceive, thinking about getting pregnant, who are pregnant, even women who are breastfeeding, we don't turn off our detoxification system, our physiologic detoxification system. It involves the liver, it involves the skin, it involves the lymph system, it involves the lungs, it involves every cell and tissue of your body is constantly detoxifying. So this whole idea that you have to do a quote unquote detox in order for your body to detoxify is actually kind of a myth. But there are helpful programs, helpful strategies you can recommend to your clients in order to help optimize that system, make sure that it's functioning well. It exists as a part of your physiology, and your job as a holistic and functional practitioner is to help patients and clients better understand that detoxification system and optimize its functioning. And that can happen anywhere through that perinatal year. We can do the most in that preconception phase, that phase where women are thinking about getting pregnant, but they haven't started actively trying. And there are some reasons for that. So let's jump right in. So the best part about working with this population is they are very motivated. Women who are thinking about getting pregnant really are beginning to think about taking care of their own health. They know that it impacts their ability to get pregnant. They know that it impacts their ability to stay pregnant, have healthy pregnancies, have easier labor and deliveries, and have healthier babies ultimately. So this is a great population to begin working with, and it's women in your community who are seeking your services. So, but wait a minute, isn't detoxification during pregnancy risky? So that's what we hear all the time, right? From practitioners are sort of promoting quote unquote detox programs. They're like, oh, you can't detox during pregnancy. That's so risky. Well, to some degree, sure, it can be if you're focusing on essentially mobilizing and eliminating stored toxins during pregnancy can increase risk for the developing fetus and for the infant if the patient is breastfeeding. Because the reason that the body stores toxins in fat cells, in bones, there are lots of storage areas in the liver, is to keep those toxins from bothering our cells. And if a woman is pregnant, those toxins, if once released, will also impact the health of the cells of the growing baby. Same thing if the baby is drinking toxin-full breast milk. So yes, you don't want to be really mobilizing stored toxins and focus on eliminating stored toxins for patients who are already pregnant, who are breastfeeding, or even those who are actively trying to conceive. But the truth is, you are always toxins in the body. Everyone on this planet is being constantly exposed to toxins and constantly eliminating toxins, unless you live in some pristine area, which I don't know, honestly, if there are any of those left on this planet, unfortunately. So detoxification is a normal, healthy process that's happening all of the time. It's happening in the gut lining. It's happening in every cell and tissue. It's happening in the liver. It's happening all over the body. And our job as functional and integrative practitioners is to help our clients better understand the detoxification system so that we minimize the toxic load during pregnancy, not mobilize stored toxins during pregnancy, but prior to conception, get a woman's toxic load as low as possible. And not actually just the woman, but also the man, because toxicity can affect sperm. It affects sperm motility. We'll go into more of that. So before pregnancy, in that golden preconception phase, so I really want you to reach out in your community and find the women who are thinking about getting pregnant. And it doesn't have to be just their first pregnancy. A lot of times you can capture women who are thinking about getting pregnant for the second, third, fourth, fifth time. They're more aware of when they're more actively going to be trying to get pregnant because they already have children, and they're probably thinking more about planning their family growth because so many factors go into that, right? So you can capture their attention, their motivation. These are women who really want to be healthy. They sometimes want to have an easier pregnancy than they may have had the first time. They want to have an easier time getting pregnant than they had the first time. So don't limit your work and your community to only women who are thinking about their first pregnancies. So during that preconception phase, up to 3 months prior to being pregnant, or up to about 3 months before trying to actively get pregnant, you can really support the detoxification system at its highest level. Mobilize stored toxins with effective, research-based, evidence-based strategies. There are specific kinds of exercise programs that mobilize toxins, but you have to be careful because they're not appropriate for every single woman who's thinking about conception. You have to screen her for other issues. So there are specific there are specific toxin mobilization exercise and dietary strategies that are very appropriate, healthy to prepare, easy, and are good for a woman when she is in that preconception phase, and also good for men in that preconception phase. They are less appropriate going forward, then our strategies are going to shift. You want to help the better that you understand the detoxification process in the liver. So those of us who have a lot of functional nutrition training know a lot about the biochemistry in the liver that supports day-to-day, everyday detoxification. And so if you're practicing as a functional nutritionist, if you use nutrition in your practice at all, in your physical therapy practice, even if you're referring to nutrition colleagues as a fitness instructor or as a health coach, the better you understand the detoxification process in the liver, the better you can find referral partners who really understand, the better you can educate your patients and clients. So the better you understand this process, and it is a complex process, the easier it is to design group and individualized detox support programs that are appropriate depending on where she is in that perinatal year, easy to follow and safe. Again, even during pregnancy and breastfeeding, because these systems don't just shut off during pregnancy and breastfeeding. The liver does not stop working. We hope. If it does, we're in big trouble. So this is a schematic of the detoxification process in the liver. And as you can see, it's fairly complicated, but we really break it down in our program because there are so many nutrients involved in this process. And as a clinician, as you help your clients to understand this process, optimize the nutrients they need to have it work really well, you want this to run like a well-oiled machine without any challenges. It's very helpful for keeping that woman's body healthier. And ultimately, that's only going to help the health of her pregnancy and her baby, and can even help the health of her baby well into adulthood. So this looks complicated when we just kind of pull this one slide out of the program, but we really break it down so that you'll understand it. If we don't understand this process well, then this is what happens. So when studies are done that have shown high levels of xenobiotics, which are toxins that are found in infant cord blood. So if we can help a woman to lower her environmental toxin load and really support the functioning of that seemingly complex, but once you understand it, increasingly straightforward liver detoxification process, the amount and the variety of environmental toxins that end up polluting the cord blood of that patient's infant goes down significantly. So we really want to focus on doing that in the preconception phase, so this poor baby doesn't have to deal with all of these toxins before it even arrives in our toxic world. So we'll learn many strategies to reduce toxic load, and most of them are not very complicated. It's so important to understand the why, the how, and the when. So when is it appropriate to use these different strategies? Number one is practical avoidance. So my collaborator on this course, my co-teacher on this program, her name is Laura Adler, and she is brilliant. She is an environmental toxins expert who knows a lot about the research in this population. So she will help break it down for you again, very simply, manageably, to help clients to simply avoid getting so many toxins into their body, eating fewer of them, putting fewer of them on their skin, drinking fewer of them in water, breathing fewer of them. So for moms to be, dads to be, pregnant women, babies, young babies, infants, there are many things we can do to what Laura terms practical avoidance, to reduce our exposure to toxins, which, then you need less work from the liver and the entire detoxification system at all. And then the second part of it is, of course, supporting optimal liver and detoxification system functioning. So doing those things together helps reduce the entire toxic load of that woman, of that couple, of that baby. So we get into a lot more specifics in the program, but I wanted to give you one because I found this so important. So we talked about how many toxins are polluting the cord blood of our American babies and all the Western babies, actually all babies on the planet. That studies just happen to be done in the US, but as I said, there are, as far as I'm aware, very few extremely pristine locations that exist on the planet. So some babies might be looking even worse, their cord blood even more polluted than those in the countries where these research studies were done. So when Japanese pregnant women took chlorella tablets, so chlorella is a plant-based food that is highly detoxifying, the researchers saw significant reductions in the transfer of maternal dioxins, which is one kind of pollutant, to the fetuses. So that's really important because if there are things we can do, even during pregnancy, even during breastfeeding, we want to capture the attention of the women in our community through that whole process, preconception, well into when they're breastfeeding their babies, 6 months or a year postpartum or longer. So the bottom line is that offering a safe, effective, and evidence-based detoxification support program is a valuable service to the women and families in your community. We don't want them scared about detoxification. It should be something where they feel empowered. This program that Laura and I are offering makes it really easy because we've included 4 resource toolkits that are specifically designed for our 4 different populations of students that tend to take our courses most commonly. So these are health coaches, physical therapists, nutritionists, and fitness professionals. And if you're practicing in another discipline, if you're a nurse, if you're a physician, understanding the perspectives of all of these, and you can always utilize the health coaching perspective in any kind of clinical capacity, because all of us, everyone that's a licensed healthcare professional of any kind, has health coaching responsibilities. And that simply comes down to supporting our clients and patients to make healthy behavior changes. Because a lot of times, we can make recommendations, medical recommendations, surgical recommendations, fitness recommendations, nutrition recommendations until we're blue in the face. But if our clients haven't bought into those recommendations, they don't value those recommendations, they're not going to implement them. So health coaching is extremely valuable and can be used in any healthcare discipline. So these resource toolkits are designed to give you really specific tools. We give you 6-session program guides. We give you patient handouts. You do not have to reinvent the wheel. I've even given you marketing copy to help you fill your programs with these women in the community who are looking for your services. So you can, as soon as you finish this course and have the knowledge, bring this program to your practice and offer it right away. So stay tuned. In the third and final video in the series, we'll be discussing common nutrient deficiencies in perinatal women. So it's not just about detoxification. We also want women to go into pregnancy being fully nourished. And I mean food, that's one piece of it. They want to be having nutrient-dense food full of vitamins and minerals and fatty acids and amino acids and all of that good stuff. And we want them to feel nourished on a spiritual level, on an emotional level. That helps our clients' pregnancies not just to be healthy, but to be joyful and connected, to enhance their relationships with their intimate partners and their families, not to detract from them. So if we're thinking in a truly integrative and functional model, we want to pull in more than just the biochemistry. We want to support nourishment of the families in our practices, their minds, their bodies, their spirits. And this will help us to support our clients to have healthy and happy pregnancies and postpartum periods with their growing families. So I will see you in the next video. Thanks for being here. Bye.